All right. How do you think that went?
I think it went well. Yeah.
What went well?
I mean, I think everything went well. I mean, I think I asked all the questions I needed to ask, and I didn't break down a lot of the responses. I had good eye contact throughout. We had good rapport. I think it went well.
Mm-hmm. Is there anything that you wish you would have done differently?
Not really.
Okay. And I agree. There were a lot of things that you did well. You did have good eye contact with the patient, and you did get a lot of information. But I did notice you didn't ask about suicidality. What were you thinking?
I mean, good pickup on that. I mean, I purposely didn't ask about it. It was like a conscious thing because, I didn't think it was appropriate. The patient was clearly upset, and I thought that she would become even more withdrawn if I continued to ask her questions, especially regarding her suicide.
Okay. So it's helpful to kind of hear what you were thinking behind it, but I would say in general it is good to ask patients about suicide. So do you think in the future there's a better way to remember that? Or?
I mean, I've worked with other teams, and it's never been the expectation to always ask about suicide, especially in these kinds of patients, because you lose rapport. And I think, different patient, different circumstances, then I'll ask about suicide.
All right, how do you think that went?
It's so bad. Oh my god, it's so bad.
Why do you say that?
I feel like I didn't do, it was bad from the beginning. Like, I didn't feel like I had good rapport. Can we just do it over again? It was so bad. Like, everything was just, I didn't ask any of the right questions. The timing was all off. It was just bad.
Well, do you think there's anything that went well?
No. I don't. Like, nothing. It's so hard. Like, I don't know why I keep freaking out like this. Like, I don't know. I don't know.
Okay. Well, what do you wish you would have done differently?
Everything.
Okay.
Just everything. Like, this is just really hard. Like, this is a lot harder, Dr. Doyle, than I thought it was going to be. Like, I don't think I can, I don't even know if psychiatry is the right field for me. I mean, this is just hard. It's really hard.
Right. Well, I mean, overall, I think you got a lot of the information, and it seemed like the patient responded pretty well to you. So, I think that there were positive things about it. I did notice, though, that you didn't ask about suicide.
I know, I didn't ask about anything when I was supposed to. Like, this is getting way too hard. I don't know. Can we just do it again? Can we just reschedule? Maybe this just won't count for anything. Let's just not make it count. Don't turn it into Dr. Anzia.
Okay. Well, if you were to do it over again, how would you remember to ask about suicide, for example?
I don't even know. I just need to do it over again. It was it was doomed from the beginning. Like, when it was just, she just wasn't talking that much, and I can't. It's just so hard. It's just me. It's me. I'm not a good interviewer. It's me. Wow.
Well, how do you think it went?
I mean, wow, that patient, it was hard. I mean, she just didn't talk that much. Wow.
Mm-hmm. Well, what do you think went well?
I think that it was just a hard patient. That's all I can say. It was difficult to get all the information, and I think it would have been a difficult interview for really any of the residents.
Mm-hmm. Well, what would you have done differently if you had to do it over again?
I had a different patient.
Okay. I mean, is there, well, for example, I noticed that you forgot to ask about suicide.
I know. I mean, I that's something that I would have asked if it was, you know, a different patient. It was just really difficult to get any information.
Mm-hmm. Sure. And it did seem like they were a little bit reserved. But I do think you got quite a bit of information, though. And so is there a way that, you know, you could maybe remember to ask about suicide if you ever had a patient like this again?
It's something I never forget in patients that are more forthcoming with what's going on. So, like, just different circumstances.
Okay. All right.
I think that's
All right. How do you think that went?
I think it went well overall. Yeah.
What went well?
I mean, I think that I asked a lot of good questions, had really good rapport, and I think I'm feeling really good about my interview skills. Like, I think I've really progressed a lot over the last couple months, and I you know, I'm starting to just really get it, and I can see myself improving. So it's great.
Yeah. Well, good. I'm glad to hear that you feel like, you know, over time you've gotten better.
Yeah.
Do you think there's anything you wish you would have done differently?
I mean, I'm sure there's things that, of course, this point in my training, there's things that I'm gonna miss here and there, but overall, I think I did a really good job, especially where I'm at, and I know that I'm gonna get there. You know, I'm kind of already there, definitely in terms of like my level, but it just, you know, yeah, I feel really good.
Mm-hmm. Well, and I think, you know, it did seem like you had good rapport with the patient and you got a lot of information, which is great. But I did notice that you didn't ask about suicidality. So what was your thinking behind that?
Yeah, no, I mean, like I said, I'm gonna miss things at this stage, but I'll definitely remember it next time.
Mm-hmm.
Yeah, I mean, I think I'm just gonna continue to improve, and you know, I think the next time we do this together, it's going to be perfect, and I won't forget about suicide.
Mm-hmm. How is there a way that you can help yourself remember for next time?
I think I'll just keep getting better.
Mm-hmm. Okay, so maybe with time you feel like, but I mean, is there anything you could?
I mean, I think I'm already there. I just, you know, I think one more, and you know, I definitely won't forget about suicide. You know.
Well, how do you think that went?
I mean, I think it went okay overall. There are definitely things I would like to have done differently. Always forget to ask about suicide, so that's definitely something I would like to work on. I would have liked to have gotten a little bit more about family history. But I think overall I had good rapport with the patient, good eye contact, and you know, the timing was okay. Like the flow of the interview, I think went well.
Mm-hmm. Yeah, I agree. It does seem like the flow went well. It seemed like you got a lot of information in a short amount of time. But I do agree. You did forget to ask about suicide. So in the future, what do you think you can do to remember?
Yeah, so in these last couple minutes I've been thinking about it because it does seem to be something I'm forgetting. I was thinking about tagging it on to like when I'm doing the depression screening, just like the review of systems. I was thinking about tagging on to that because I never forget about that.
Mm-hmm.
I don't know what your thoughts are.
Sure. I mean, if it's something that you do with every interview and you don't forget it, it makes sense to kind of add it into something that you know you're going to ask about.
Okay.
So let's try that for next time.